Okay, we're back. Now we're going to go to part two. This is shorter. It's pre labor, also known as false labor, and the onset of true labor. How does that process happen? Wait till you find out. Pre labor, also called false labor, your book calls it false labor, ATI calls it false labor. It makes me crazy because it's very discouraging for a woman to hear that these contractions she's been having aren't actually true labor. Um, Pre labor consists of Braxton Hicks contractions. And the difference between true labor and false labor is that, or pre labor does not noticeably dramatically change the cervix, whereas true labor involves cervical dilation and effacement. Okay, progressive change. Some characteristics of pre labor contractions can be irregular. They're usually spaced pretty far apart. They could be 4 minutes, they could be 8 minutes, they could be 10 minutes. Usually, if you walk, hydrate, rest, they go away. Um, they generally are only perceived in the abdomen. They may be perceived as just tightening without pain, or they might be crampy, but they're usually only in the abdomen. You don't feel them in the back. In true labor, where you have progressive cervical dilation and effacement, you're going to have pain that radiates to the back as the baby moves down. But the biggest difference is that your cervix doesn't change. Um, Women should not feel discouraged. We usually use the 5-1-1 rule. Some people refer to the 4-1-1 rule. When your contractions are 4 or 5 minutes apart, depending on the provider's advice or your triage policy, and they last at least 1 minute, 60 seconds, and you've had that happening for at least 1 hour, now it's time to get checked. If they don't last for an hour, if they're not at least 60 seconds long, and if they're not at least 5 minutes apart, it's probably pre-labor. Now, something to know about pre-labor, things are happening, quite a few things. Number one, the cervix is ripening, and that means it'll be more receptive to the contractions. It'll change faster. Think of the real stiff rubber band on broccoli. You have to apply a lot of force to get it to get bigger, to stretch it. And then think about the elastic and like a rubber band that's thin. When it's thin, you can, stretch it, snap it at your friends, do whatever you want with it because it's got that elasticity. So the cervix needs to become softer, needs to become thinner before it's actually going to dilate. And those changes are important. It also helps when the cervix moves from posterior to anterior because that kind of positions the baby in a way that's going to make things work a little bit better. But women should not be discouraged if they're in pre-labor. Now, mechanisms of the onset of labor. I did not include this graphic so that you could actually memorize what's in all the little text boxes. I just wanted to show you it's complicated. I mean, look at it. It looks like the instructions to something I might have bought from IKEA. And like things I buy from IKEA, there are pieces missing. There's things we don't know. But generally, the factors that are involved are hormonal. There's a spike in estrogen, there's a drop in progesterone. We have release of cortisol by the fetus as the fetus gets stressed by the aging placenta. So there's placental factors. Over distension of the uterus as the baby grows and there's higher amniotic fluid volume. It kind of tells the uterus it's time to get ready. Lightning is the sensation of the baby moving down in the pelvis. Remember we talked about that discomfort, that like mild shortness of breath that people get because their diaphragms are being pushed upward as a baby engages in the pelvis. That doesn't happen. So that's one of those signs. Also, there's a release of prostaglandin. Now, do you see where like the medications like Cytotec and Cervidil, those prostaglandins you might be getting familiar with in clinical, the body releases prostaglandin over weeks. We try to get it to speed things up. So if you understand some of the mechanisms, you can address labor starting on its own. And you can address things like preterm labor. If you know that cortisol stimulates the production of prostaglandin, stimulates the release of oxytocin, which will cause contractions. Now you understand why somebody at 30 weeks who's under a tremendous amount of physical or emotional stress, releasing a lot of cortisol, that could be a factor in preterm birth. So it's important to investigate what the mechanisms of labor are, but it's really almost unknown why some people will deliver at 37 weeks, and some people will deliver at 42 weeks, and they need to be induced at 41 or 42 weeks because now the placenta is aging. It helps to understand some of the factors, even if it looks like the instructions to put together a bookcase from IKEA. What are some signs of impending labor? Obviously, Braxton, if you're having a lot more Braxton Hicks contractions, Braxton Hicks are those contractions that don't always cause cervical change right away. If you're seeing an increase in that and they seem to be getting stronger, you know that labor is probably getting ready to start. Women get a sudden burst of energy because of the hormonal shift, because progesterone isn't making them so tired. They get this burst of energy and they start nesting or getting ready. They might, at that point, put together stuff or get all the baby clothes in the washing machine or scrub their floors or make a casserole for when, they're not going to be there. But they get that sudden burst of energy and that instinct to build the nest. It's another sign of impending labor. GI symptoms can include diarrhea. As the progesterone drops and the prostaglandins are produced, we have more motion of peristalsis, and sometimes that manifests as diarrhea. You'll also see a weight loss of 1 to 3 pounds in some women, and you might get the loss of the mucus plug. I know it sounds gross and it kind of is, but people will call you and say, I lost my mucus plug. Should I come in? And you're like, not yet, but probably in a few days. And a little bit of bloody show. Sometimes that mucus has a little bit of blood tinge to it because there's a lot of blood vessels. Estrogen is supplying a lot more blood to the cervix to help it do its job. And so that mucus might be a little blood tinge. We call that bloody show. It's not a cause for alarm as long as the amount is small and it's like a pink tinge and not frank red bleeding that's soaking a pad, or dark red bleeding that could be an abruption. If it's just that blood tinged mucus at term, people don't get too excited about it, but know that labor should be coming soon. And that's it for now. So I will be back on part 3.